My name is Robert Vitral. I'm a professor at the Federal University of Juiz de Fora, and we will present the article Influence of hyrax expander screw position on displacement and stress distribution in teeth, a study with finite elements. The other authors are Letícia Chaves Fernandes, Gustavo Silva Maximiano, Dr. Pedro Yoshito Noritomi, and Professor Marcio José da Silva Campos. This article is the second part of a research which aimed to evaluate the effects of the hyrax expander screw in different positions. The research was carried out in a collaboration between the graduate program in dentistry of the Federal University of Juiz de Fora and the Renato Archer Information Technology Center Campinas, both in Brazil.
The first part was presented in the article Influence of the hyrax expander screw position on stress distribution in the maxilla, a study with finite elements. Published in 2019, it aimed to evaluate the stress and deformation distribution patterns on the maxillary bone structure. We concluded that different positions of the expander screw interfered with stress intensity and distribution patterns. When the expansion screw was simulated in a more occlusal and anterior position, it was more efficient to transfer the mechanical effects from the appliance to the bone structures. On the second part, the study aimed to evaluate tooth displacement and the stress distribution standard on the periodontal ligament using the finite element method. A computer-aided design model was employed. It included the maxilla, the skull base, the central incisor, the lateral incisor, the canine and the first premolar, the second premolars, the first molar, the second molars, the periodontal ligament, and the bone suture unit representing the median palatine suture. There were two vertical positions at distances of 20 and 15 millimeters from the occlusal plane. Another three positions were anteroposterior, with the center of the screw placed between and equidistant from the mesial face of the first molar and the distal face of the first premolar, aligned to the center of the crown of the first molar, and the anterior edge of the screw aligned to the distal face of the first molar. The initial activations of the expanders were simulated, and the total displacement, the vertical displacement, the buccolingual displacement, the vestibular and lingual tensile stress distribution on the periodontal ligament of supporting teeth, and the vestibular and lingual compressive stress distribution on the periodontal ligament of supporting teeth in each model were registered. The supporting teeth presented a tendency for vestibular crown displacement and lingual root displacement associated with compression areas in the vestibular cervical region and tensile strength in the lingual apical region. Placing the expander screw in a more occlusal and anterior position generated more mechanical stress transfer, resulting in greater dental displacement. We would like to thank the support of CNPq and Capes, which allowed us to develop this research.